Welcome to Ulosca channel. Access all nursing practice questions. PN Fundamentals NGN practice questions with answers.
Question 1. A nurse is reinforcing teaching with a client about hand hygiene. Which statement by the client indicates understanding? A. I will wash my hands for at least 10 seconds. B. Hand sanitizer can replace hand washing after using the restroom. C. I should scrub all hand surfaces when washing with soap and water. D. It's not necessary to wash my hands if I wear gloves. Which one is the correct answer? The correct answer is C. I should scrub all hand surfaces when washing with soap and water. Explanation. Proper hand washing includes scrubbing all surfaces for at least 20 seconds. Gloves do not eliminate the need for hand hygiene before and after use. Question 2. A client is on contact precautions. Which action should the nurse take? A. Leave the door open to monitor the client. B. Don gloves and gown before entering the room. C. Use sterile gloves when providing care. D. Remove PPE after leaving the client's room. Which one is the correct answer? The correct answer is B. Don gloves and gown before entering the room. Explanation. Contact precautions require gloves and a gown to prevent the spread of infectious organisms through direct or indirect contact with the client or environment. Question 3. Which action by the nurse helps prevent medication errors during administration? A. Relying on memory to recall medication details. B. Administering medications prepared by another nurse. C. Comparing the medication to the MAR 3 times. D. Skipping the barcode scan if the medication is familiar. Which one is the correct answer? The correct answer is C. Comparing the medication to the MAR 3 times. Explanation. Comparing the medication label to the MAR 3 times is a safety standard to ensure the right drug, dose, time, and patient. Question 4. A nurse is caring for a client with dysphagia. What is the appropriate nursing intervention? A. Encourage the client to lie flat while eating. B. Offer thin liquids with meals. C. Instruct the client to tuck the chin when swallowing. D. Allow the client to self-feed without supervision. Which one is the correct answer? The correct answer is C. Instruct the client to tuck the chin when swallowing. Explanation. The chin tuck technique helps close the airway and direct food down the esophagus, reducing the risk of aspiration in clients with swallowing difficulty. Question 5. When preparing to administer a blood pressure check, what should the nurse do first? A. Place the cuff over the client's clothing. B. Have the client hold their arm above heart level. C. Ensure the client has rested quietly for at least 5 minutes. D. Use a cuff that covers less than 40% of the upper arm circumference. Which one is the correct answer? The correct answer is C. Ensure the client has rested quietly for at least 5 minutes. Explanation. Allowing the client to rest helps stabilize vital signs and ensures an accurate baseline blood pressure reading. Activity or stress can lead to falsely elevated results. Question 6. Which client statement indicates an understanding of proper cane use? A. I will hold the cane on my weak side. B. I should move the cane forward with my weak leg. C. I need to look at my feet while walking with the cane. D. I should use the cane only on stairs. Which one is the correct answer? The correct answer is B. I should move the cane forward with my weak leg. Explanation. When using a cane, it should move forward at the same time as the weaker leg to maintain proper balance and support. The cane should be held on the strong side. Question 7. A nurse is reinforcing teaching about pain management. Which non-pharmacologic method is appropriate for chronic pain? A. Keeping the room brightly lit. B. Guided imagery and deep breathing. C. Cold therapy every hour. D. Encouraging complete immobility. Which one is the correct answer? The correct answer is B. Guided imagery and deep breathing. Explanation. Guided imagery and deep breathing are cognitive behavioral techniques that promote relaxation, lower stress levels, and help manage chronic pain without medication. Question 8. A client with limited mobility is at risk for pressure injuries. Which intervention should the nurse implement? A. Massage reddened areas to improve circulation. B. Use a donut-shaped cushion. C. Reposition the client at least every 2 hours. D. Keep the head of the bed elevated at 90 degrees. Which one is the correct answer? The correct answer is C. Reposition the client at least every 2 hours. Explanation. Repositioning every 2 hours relieves pressure on vulnerable areas and promotes circulation, which is key to preventing pressure injuries in immobile clients. Question 9. A nurse is preparing to insert an indwelling urinary catheter for a female client. Which action maintains surgical asepsis? A. Opening the catheter kit without touching inside the wrapper. B. Cleaning the perineal area after donning sterile gloves. C. Touching the catheter tubing with bare hands. D. Holding the catheter tip while positioning supplies. Which one is the correct answer? The correct answer is A. Opening the catheter kit without touching inside the wrapper. Explanation. Surgical asepsis requires maintaining a sterile field. Touching inside the kit or the catheter with bare hands contaminates it and increases the risk of infection. Question 10. A nurse is reinforcing discharge teaching for a client prescribed a low-sodium diet. Which food selection indicates understanding? A. Canned soup and crackers. B. Ham sandwich with pickles. C. Grilled chicken and steamed green beans. D. Bacon and scrambled eggs. Which one is the correct answer? The correct answer is C. Grilled chicken and steamed green beans. Explanation. Grilled chicken and steamed green beans are naturally low in sodium. Canned, cured, and processed foods are typically high in salt and should be avoided.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.